For most of us, being licked by a dog is enough to make our heart melt, regardless of the bad breath and stringy slobber. However, for some dog owners, their pup's lick comes with something much worse. Back in 2019, Marie Traynor felt unwell after returning from a vacation in the Caribbean. At first, she thought she had the flu, but after developing a fever, nausea, and backache, she went to the hospital. Soon after arriving, her condition rapidly deteriorated. She became unconscious and was put into a medically induced coma. Her arms and legs horrifyingly turned purple as gangrene set in, cutting off the blood supply to her limbs. The doctors were baffled. Initially, they thought she had a travel-related illness, but 7 days later, they made the shocking discovery of the true cause of her condition. It wasn't a tropical disease, but rather it had come from her dog licking a cut on her arm. Harmless as it may seem, the saliva of most dogs contains a bacteria called Capnocytophaga canimorsus. This bacterium normally spreads through bites, but sometimes all it takes is an innocent lick on an open wound for transmission to take place. To prevent the deadly infection from spreading, doctors removed the affected areas from Traynor's body. Unfortunately, this meant amputating her arms and legs. Luckily, capnocytophaga isn't usually this dangerous to humans. Typically, the symptoms resemble those of the flu. Yet in rare cases, it's extremely deadly. So much so that about 3 in 10 people who develop a serious capnocytophaga infection pass away. Sadly, that was the case for a 63-year-old German man who also contracted the disease when he was licked by his dog. He went into fatal septic shock, causing several of his organs to fail after just 16 days of treatment. But remember, as lethal as these cases are, it's still extremely rare. So keep playing with your canine companions, and just make sure to wash any slobber off post-playtime.